Hi, this is David Gazzaniga, and I'm here to talk to you about some common sports injuries regarding the shoulder. I am the Division Chief of Sports Medicine at Hoag Orthopedic Institute. We'll talk about a little bit baseball and swimming, pretty much overhead type of activities. So shoulder, we'll go a little bit through shoulder anatomy, throwing mechanics, swimming mechanics, common injuries and treatments, and a couple exercises right at the end. So first, we have to understand the anatomy to understand how these things work and why they don't work and why they run into problems. For the most part, the shoulder is fairly complex in terms of its organization because you have a shoulder blade, which is relatively mobile on your chest, on your rib cage, and then you have a shoulder joint, and then a number of muscles, of 17 muscles that attach to your scapula, and they all need to work together in proper form, and there has to be stability, so we'll see how that all comes together. So looking from the front, we have the larger muscles such as the deltoid and the pectoralis. Towards the back, we have the latissimus, we have our triceps muscles, the back of the deltoid, our trapezius. All of these, including the rotator cuff muscles, which attach onto the scapula itself. So we're going to talk about a couple of terms. There's external rotation gain, there's internal rotation deficit, a superior labrum tear anterior to posterior, rotator cuff, which is made up of four muscles, the one in the front, the subscapularis, the top, supraspinatus, and towards the back is the infraspinatus and the teres minor. We talk about throwers having a dead arm sensation. When they throw, they kind of feel this sensation. Swimmers can get it as well as volleyball players and tennis players. So any overhead athlete pretty much can have these sort of issues. So we're going to look at throwing mechanics, and anything that involves throwing will have some of these similarities, but a baseball pitcher is particularly susceptible to these problems, and we'll understand why. So for overhead throwing, obviously requires repetitive maximum stress. So someone who throws a fastball is throwing essentially at full capacity every time he or she throws. This is a delicate balance between having enough range of motion to throw, but having enough stability for your arm not to get into damaging positions. So throwers also have to work on accuracy, velocity, spin production. So this is a player, Chapman, who's was able to throw a baseball at 105.1 miles per hour, which is the fastest recorded in a game that I know of. But our arms and shoulders were not designed to throw things quite that hard. He is, through years of training and ability, he's been able to get to that position. When we talk about throwing, we look at pretty much 5 stages of throwing. And so there's the wind-up, early cocking, late cocking, acceleration, and follow-through. And different parts of our shoulder will be involved in different aspects of this. So obviously in the wind-up, there's very little potential for injury. So the pitcher faces the batter, the pivot foot rotates on the rubber, stride foot coils back, the finger position on the ball will be finalized, the balance, and then start the beginning of the throw. So this is where the stride comes into play, and off the back foot, pushing forward, accelerating the body towards the target. The arm is rotated up and back, and at this point it's very similar to casting bait in fishing. You're creating potential energy in your shoulder and your arm, delivering it then ultimately to the ball. The energy goes all the way from the feet up through the hips, shoulders, elbows, all the way to the ball. So as we go forward, here the injury potential starts to go up because there's a rapid forward motion of the trunk, the legs driving forward, the trunk rotating towards the target. And as you can see in Randy Johnson here in the middle, his arm is externally rotating, not because of his muscles so much pulling it in that direction, it's because his arm is being left behind, creating potential energy as his body is launching forward. So here the muscles that are used, the infraspinatus and teres minor, working a little bit to move it backwards. The subscapularis and the biceps tendon are working to keep the shoulder in good position. And then at the end of this late cocking stage, you have maximum external rotation. As you accelerate forward, the arm then goes from this position of potential energy, creating then obviously kinetic energy for you physics buffs. So this is then turned into, from external rotation into internal rotation, and the arm accelerates forward, and this energy then is transferred to the ball, and that's what creates the speed and the action on the ball as it's being thrown. The acceleration phase obviously ends with the ball release, and the muscles used to position the shoulder in this and to drive the shoulder forward. The latissimus is an internal rotator of the shoulder. The pectoralis major is an adductor, bringing the arm across, and the subscapularis working in similar fashion. So if someone has anterior instability, this is where the injury might occur. So as the ball is released, potentially you could have posterior instability causing a problem. The muscles in the back of your shoulder and around your shoulder blade have to now work extra hard to prevent your shoulder from going down towards the catcher. So as the ball is released, all these muscles have to kick in to slow your arm down before you hit yourself in your thigh. So that's the trapezius serratus anterior, the rhomboids, which are in the back, the posterior deltoid, and the teres minor, which is probably the most active at slowing your shoulder down. So again, these are the 5 stages of throwing, and that's sort of the overview of where injuries can occur going through those motions. If you look at swimming mechanics, very similar. Shoulder pain is very common in swimmers. Anybody who sees an elite swimmer, we all get jealous of the way their backs look because they tend to be very well developed. Elite swimmers move their shoulders an enormous amount. They train 60 to 80,000 meters per week, which is almost 50 miles on the high end, and that's about 30,000 strokes per arm. Most training is done freestyle, regardless of stroke, so freestyle is really the one that we focus on in terms of conditioning and keeping the shoulders healthy. So most power is generated by the pectoralis and the latissimus, similar to the throwing motion, because that's what adducts, brings your arm across your body, and internally rotates, turns your arm in. So here you're looking at this swimming motion, very similar to what the throwing motion looks like, except in a obviously prone type of position. So enter the water, reach forward, pull through, and then exit the water, and then the mid-cycle, bringing the arm back around. So as you look at this, pain is most often associated with increase in training yardage, poor technique. This may be early season problems or fatigue later in the season. When you watch someone swim, the picture above would show that a good swimming technique is to have the elbow high out of the water. But what sometimes happens is that you over-rotate your body to get into this position. So the lower picture is an ineffective way to swim. Someone who might have shoulder problems, to avoid extending and externally rotating the shoulder, this person has turned their body, and you can see their lower hand is crossed over the plane of their body, and that's a poor swimming position. So common injuries, shoulder injuries and adaptations. So you can get problems in the back of the glenoid, which is the cup of your shoulder. You can get bone spurs, impingement, rotator cuff injuries, very common, tendonitis of your biceps. Problems at your acromioclavicular joint is where your clavicle meets with your shoulder blade. You can get instability, impingement, the superior labrum tears like we talked about, nerve entrapment, scapular problems or shoulder blade problems. You can have internal rotation deficit, labrum tears, and in particular, throwers might have laxity or instability, and suprascapular neuropathy is an interesting one. So common overuse injuries in swimmers and overhead athletes. For swimming, this position of impingement where the rotator cuff and the acromion become close together happens about a quarter of the swimming stroke, so it happens very commonly. In throwers, when they abduct and externally rotate, the shoulder or the head of the humerus can pinch the rotator cuff in between the head of the humerus and the back of the glenoid. This can happen for different reasons, but it's usually in the stages of abduction, externally rotation, which is in late cocking, early acceleration period. So the most important pathological process in throwers is loss of internal rotation, and that comes when you have this contracture of the posterior capsule, and it's pretty easy to find in people. So this internal impingement can be demonstrated in this video here, which we'll start for you. So as the arm externally rotates, you can see the rotator cuff running up against the edge of the cup there. The head above is rotating, and there you see that's where the damage can occur in those people. So typically by contracture of the posterior capsule drives the position of the head into an improper position, and they start to get this impingement. So what can happen over time? You get degenerative or acute injuries. There's a lot of stress on the rotator cuff, and we look then at different things that can be injured. A third of the slap lesions will also have a rotator cuff tear, so these things tend to occur together as they degenerate. And what happens when a major or an elite baseball player gets a rotator cuff repair? Well, from Jim Andrews, who's sort of the grandfather of baseball throwing shoulders and elbows, 1 out of 16 elite baseball players were able to return to play following complete rotator cuff tear. In other words, you tear your rotator cuff completely, you're pretty much completely done with baseball. So here we're looking at superior labrum tears, anterior to posterior. This just means the location of where this labrum is. It's at the top of the shoulder. This has been something that's been evolving over the past couple of decades, really, from something we just discovered to didn't understand and fixed too often to now getting a better idea what this actually means. The thing is about a superior labrum tear is that if you have one and you have to repair it, surgical repair can result in good return to pre-injury level, but if you look at elite throwers that have superior labrum repairs, their return to their previous level of activity, previous performance level, is probably in the single digits. So that's why when we look at labrum tears, we don't necessarily jump on the idea that we have to fix them. This is borne out by the fact that if you look at MRIs of asymptomatic Major League Baseball players, half of them have rotator cuff tears and half of them have labrum tears. And if you do an MRI study of these asymptomatic pitchers, also done by Miniaci, labral pathology of some sort was seen in about 80% of those people. That is to say, when I have people that come into the office and they say, I have an MRI that says I have a labrum tear, and I ask them whether they have pain, they say, not really. We don't necessarily have to operate on just because we found that it's there. This quickly, internal rotation deficit is something that's typically developed over time in overhead athletes, which essentially means that their shoulder does not internally rotate as much as the opposite side. So if you look at the picture on the top right, this person, same person, 2 different shoulders, this is literally how far he can internally rotate his right shoulder. So there's a significant deficit there that he's developed over time of overworking one side of his shoulder and neglecting the other side. So 90% of symptomatic internal rotation deficit less than 25 degrees, however, will respond to stretching program, and it doesn't have to take that long. The scapula is evidence of other defects in the shoulder in terms of throwing and overtraining in one direction. The scapula, we use this term, sick scapula, which was coined. It has to do with scapular malposition, the positioning of the shoulder blade. If the pectoralis and the short head of the biceps overpulls the scapula, it will cause a malposition of the scapula. So when you're trying to throw or swim or serve in tennis or hit a volleyball, all of these things can be disrupted and cause further injury by this malposition or just straight having pain. So here we are some quick exercises. We have the sleeper stretch, which is trying to stretch out the posterior capsule. It can be very effective for those who have internal rotation deficit. On the left, we have a woman stretching her trapezius. In the middle, we're stretching our pectoralis. On the right is a therapist actually trying to stretch the pectoralis minor. by a particular form of stretching and exercise. Strengthening, we do these push-ups. The push-ups then go a little bit farther, called a push-up plus, where we try to work on strengthening the serratus anterior. We can do rows to try to strengthen our posterior deltoids, our traps, and our rhomboids. Here are a Y and T exercises, which are also designed for strengthening your scapula and being able to better position your shoulder and having better posture. So in conclusion, pitchers that have physiologic adaptations to their shoulder, they can be protective and not necessarily a cause for concern, but we have to be careful about how our shoulders move, and so posterior immobility is bad. We have to work on stretching that. Don't forget about the scapula, because that is where our shoulders get into position to try to avoid injury. All overhead athletes should have some form of conservative treatment before rushing off to do surgery, because there's a lot of things that you can find that don't need surgery. And swimmers need to pay close attention to changes in training and altered stroke pattern and maintain good form and strength for the scapular stabilizers while stretching to avoid scapular dyskinesia. All right. So now we can take some questions. Thank you, sir. All right. Question number 1. My son is a college football player. What's the best way to prevent injury in shoulders or legs from fast running or throwing? In terms of, so the things that we went through, if your son is a football player, avoiding injury may be impossible. And I say that somewhat in jest, but also there are things that occur on a football field which you cannot completely prevent. The key thing, I think, for training, though, is good form when you're lifting, proper warm-up, not excessive in terms of how the exercises are done. Obviously, you want to train to the maximum of your strength, but if you're using poor form in order to achieve that, then you will be set up for injury in that circumstance. So the shoulders can be susceptible. I like for all strength training to be done without any military press or overhead presses, and you have to be careful about doing heavy weights with a close grip on the bench press, because that drives your shoulder back and could potentially be a cause for posterior labrum problems. All right. I play lots of tennis and my shoulder hurts. When do I know I need to get this checked out further? Well, if your pain in your shoulder interrupts your ability to play tennis, or if it lasts for a couple days after tennis, then that might be a problem. It would be good to understand why your shoulder hurts and to focus on training and focus on how to make your shoulder more adaptable to that. There are a lot of tennis players, unfortunately, that end up with rotator cuff tears over the years, and some of them end up having to play without serving overhead. So probably a good idea to get it checked out if it's been going on for a while. I just started doing swimming laps for exercise. What is the best way to avoid shoulder injuries? Well, we went through that on the talk, and I think proper warm-up. If you just jump in and start as a swimmer, then you're bound to end up with some problems if you're not careful. So you want to do the exercise. So swimming is great exercise, and you will obviously develop muscles and strength, but you have to also, outside of the pool, which is why swimmers do a lot of dry land exercises that focus on strengthening of their back and maintaining their posture, and those become very important as an adjunct to swimming. If I have sore muscles and continue with my activity, can that cause further injury? Well, sore muscles are something that may cause further injury. Obviously, if you're not fully recovered from one exercise and you start another exercise, that could cause problems. But I have sore muscles every single day, so I'm not sure how to answer that one. All right. That's just part of life, is what I'm trying to say. All right. Does the knee brace to protect the knee from a biking injury need to be tight? If knee brace is too loose, will it not help protect the knee injury? Oh, I'm not sure how this question is. this question was asked. My phone was on silent anyway. The knee brace will depend on what you're using the knee brace for. Typically, you don't need a knee brace for cycling, but if you injured your knee while cycling and you have some injury to your knee, you'd have to know what kind of injury it is. In essence, a knee brace only functions if it's snug and stays in position, but a brace will always slide down, so that's always one of those problems that's difficult to answer. But I'd have to know what the injury is, what the activity is. Can internal rotation deficit, GERD, cause pain outside the shoulder? I have pain in my elbow and notice that my shoulder is limited in motion. Actually, a really good question. The answer is yes. If your shoulder has limited motion, that will then cause you to have sometimes neck pain, pain in your back, and pain in your elbow. So it depends on what's causing your shoulder stiffness. You can have frozen shoulder. You can have something called adhesive capsulitis. You can have arthritis. And then you could just have adaptive contracture, which is something that you can work on to stretch out. But if you have pain in your elbow, it could very well be coming from tightness in your shoulder. All right. How important is an active warm-up before activity and a cool-down afterwards for my athletes? I'm a softball coach, and it's hard sometimes to get my athletes to focus on the warm-up and cool-down. All right. So, yes, warm-up and cool-down is important. If you have trouble getting your athletes to warm up, this is really easy. You just have them run a lap. If someone has got their heart rate up, the blood flow that goes to your entire body is also working your shoulders as well as your legs. So if they want to mess around and not warm up properly, just have them run around. And they might be more attentive if you take that approach. The cool down is important. A lot of people like to call that the flush. And I would do the same thing. I would make them take a lap around the field, the entire field, not just the infield. All right. My son plays baseball and pitches regularly. That starts off ominous. I've heard mixed reviews about icing his shoulder and elbow after pitching. Is it necessary to ice down after each outing or only if he feels pain? Well, here's the thing. You can ice before, after, or during, but the main thing that's going to cause a problem for his shoulder and elbow is how many months out of the year he pitches. So it's recommended that if someone is a pitcher, that they do that no more than 8 months out of the year or take 4 months off. That is something that major league pitchers do, and for some reason, travel ball pitchers do not do. But the reality is that it's best to ice down after every single time. It does help with recovery, and that's what the pros do. Might as well be what your son does. Let's see. How can I tell if my high school athlete has a sore throwing shoulder or if there is a more significant injury? Well, that's a good question. I guess for the most part, soreness in the shoulder is not uncommon. It's typically something that happens after they're done throwing, and it doesn't last very long, and it recovers easily with icing and stretching. It's good, obviously, to warm up. If someone says, oh, I got pain in my shoulder from the first throw and continues on, those are things to be concerned about. A soreness in the shoulder with moving it around, that could be muscular. If they say in a particular portion of their throwing motion, particularly as we went through with late cocking, early acceleration, those are times where you have to be concerned that this is a more significant injury. So it's good to ask what part of the throwing motion, when do you feel it, how long does it take to recover? Those are questions you can ask to try to figure out if it's something more severe. Bike in heavy gear can injure the knee. Non-consecutive day of exercise can help knee rest and prevent overwear and tear of the knee joint, right? Oh, okay. So I thought I was being told. That was an interesting question. So biking in heavy gear can injure the knee, and non-consecutive day of exercise, well, I'm just going to answer this by saying the knee joint doesn't actually take a lot of wear and tear when you're cycling, with the exception of if your saddle is too low or if you prefer to do a lot of climbing, it can cause you some discomfort in your knee. I'm not sure what heavy gear is while you're cycling unless you're doing some backcountry mountain biking. then of course, yeah, it puts more stress on your legs. But for the most part, the knee is pretty healthy, and there are a lot of people who have arthritis in their knee, and they actually use cycling or mountain biking as an option for that. But there isn't a ton of wear and tear, with the exception of the tendons around your knee. That's where you can feel pain if you're not positioned just right. And so if that's something you're concerned about, it would be good. There are a lot of cycle shops that can fit you and adjust and help you to understand where your best position on your bike would be. Is that it? Any questions from the audience? We don't have an audience, so I was just kidding. Oh, am I supposed to end now? All right, I'm going to say thank you to all of you for watching. We're right here at Hogue if you want to come by and take a look at your shoulders, elbows, knees. There's a lot of great orthopedic surgeons, primary care, sports medicine doctors, and thank you for listening.